But we just stood in the gym for a couple of hours one evening just chatting. And then after that we started chatting on Facebook, as you do, messaging each other. It just seemed really nice.
Okay, mate, there'll be a voice telling you to breathe in and hold your breath. Just do the best you can, okay?
He was like, do you want to go out for dinner? We went to Pizza Express and we were there and we basically got kicked out because we were the only ones there chatting. And he came back to mine. I think he left probably about 2:30, 3 in the morning. It's that proper like, do I like him? Yeah, I think I like him.
Breathe in and hold your breath.
Should be alright now.
Yeah. Anyway, I'll have to be going now. Anyway, I'll have to be going now.
I'll have to go now.
I'll see you soon.
And you will indeed,
Yeah,
okay?
okay.
Alright.
Very much.
Thank you very much indeed.
Yeah, man, just caught my leg, man. I was jumping the wall, innit, and I caught the edge. Right, fam, the cut is deep as well. Yeah, I'm waiting now. I'm at the waiting area to be seen. Yeah, I'm at the A&E.
Who took my bloody papers?
George's ED? Yeah. Yeah. Okay, thank you very much. Adult trauma call ETA 10 minutes. Adult male trauma booked into resus 6, please.
A 36-year-old man has been rushed to St George's after being involved in an accident whilst playing football.
I was in a supermarket shopping when I got the phone call that Justin had had an accident. I thought she told me that he'd broken his thumb, but because they were driving, I still couldn't really hear what had happened. But I did hear them say Justin was being taken to St George's Hospital. At that point, I realised that it must be something serious.
Everyone said my life would revolve around school. Not WGU. Their online programs mean I can work on my degree anywhere, anytime, and become a teacher on my schedule. Learn more at wgu.edu.
It's mine. The price has blown my mind. I feel so rich. I feel like a billionaire. I'm shopping like a billionaire. I'm shopping like a billionaire. I'm shopping like a billionaire. I get it straight from the makers. I'm shopping like a billionaire.
Download the Temu app and shop like a billionaire.
I thought it must be his arm or his leg, dislocated something, broken something. What sort of injury can happen while you're playing football?
Hi. Hello. This is Justin. He's a 36-year-old male. At 6:46 this evening, he was playing football, ran backwards into a brick wall. KO for 5 to 10 minutes before delivery. On the arrival of the first responder, he was a G6 of 3, ended up to a G7 of 12. He was traumatic loss on arrival. He has a large soft wound to the right side of his head.
And I think how long?
5 to 10 minutes.
5 to 10. Yes. Very small accidents can occur that can have devastating consequences. A simple fall or a trip can cause them to have a severe or potentially lethal brain injury.
Okay, let's do a primary survey.
If a patient's had a loss of consciousness, it implies that the injuries was severe enough to temporarily shut down the brain.
Justin, you're in hospital. Justin, stay calm. Take a deep breath.
Airway's okay, chest is clear. He's moving his legs pretty well, so his femurs look okay.
X-ray, V6. That's it, Justin.
It's not working. And that's with some ketamine, isn't it? So it's a bit unfair.
Justin, try and stay calm.
A patient who sustained a head injury may become very aggressive and quite unlike their normal selves in everyday life.
Hey, Justin. Justin, stay calm. Okay, Justin.
It's also an indicator that the brain has suffered a degree of injury that's concerning.
Stay calm, mate.
So, we're going to need some intubating drugs.
Yeah.
There's a bit of ketamine, fentanyl, ketamine, rock.
Doctors need to place Justin in a medically induced coma so they can take urgent scans of his brain.
Okay, cheapers.
I was in complete and utter shock. You just go cold, or you just lose all your sense of feeling. He's my life.
6 foot, big man.
Doctors are awaiting scans of Rich's spine after he lost sensation below his waist in a motorbike accident.
Good. Out of 10, what's your pain like?
Don't breathe.
Yeah.
Dear.
About 7 or 8?
Close.
Sorry, Richard, I'm gonna have to uncover you just for a sec, okay? Touch your female cables, do you?
Rich's mum and dad separated when he was born, and so his mum and his grandparents brought him up. They didn't want to leave Caden, like he felt like his dad left him. So I think that's always pushed him to be a better father. When you see him with Caden, like messing around and playing, they're really sweet.
What's your partner's name? Is it wife, girlfriend? Hannah, wife, girlfriend? Girlfriend. And is she the mother of your child as well?
No, we've got one on the way.
You've got one, oh, right. How far along?
September.
I remember finding out that I was pregnant and being completely shocked. And actually, Rich seemed more excited than I did. I never knew if I wanted a kid anyway myself. I spent my 20s trying not to get pregnant and my 30s debating whether or not to have a baby. So it's only now that I'm nearly 40 that it was like, yeah, actually I would quite like a baby.
It's not too far away. You looking forward to it?
Not like this.
Doctors now have the preliminary results of Rich's CT scan.
Richard, so looking at your scans, you've got a couple of rib fractures around here, and your breastbone's got a fracture through it. Probably the most significant injury is the one on your back. At the moment, it looks like there's a fracture on one of your spine vertebrae, around sort of tummy chest area. I'd just like to re-examine you again, just to see if that's changing. When someone comes in with spinal trauma, we reassess the patient to see what their true level of function in their legs are, to see whether they've got any sensation, to see whether there's any movement in any part of the leg. I'm going to start with your head, okay? Can you feel me touching your hair?
Yeah.
Can you feel that?
Yeah.
And is it the same?
Yeah.
On both sides? Same?
Yes.
Less. I've just touched you. Could you feel anything? No. Just, when I touch you, just say yes. And the feet. Richard?
Yeah.
I'm touching you around your knee area.
No.
Nothing. Can you move your feet for me? Okay. Are you reflexive flaccid paralysis with a definite T6 sensory level. Flaccid paralysis is when your legs stop working and they stop working in a way that they become wobbly rather than stiff. First thing that runs to my mind is spinal shock. The spinal cord has taken a big injury and it's decided to shut down and stop working.
Rich's girlfriend Hannah has arrived at the hospital.
Our now